Just exactly who will be getting the coronavirus vaccine? That's $1 million question. And when is that going to be happening?
That's right. Joining us now to talk about it is Dr. Timothy Quinn to discuss the vaccine and what we can expect. Dr. Quinn, thank you for joining us.
Hey, thank you for having me.
Let's talk about what can we expect when the vaccine becomes available.
Well, the deal is a lot of information is being released, and the pharmaceutical companies are not trying to hide anything. They are revealing that some of the subjects in the studies have had some side effects. And some of these side effects include fever and chills, some fatigue, some headaches, some muscle pain, some discomfort. But they're reassuring that these vaccines, and the FDA is very, very in line, they are safe, meaning that the benefit outweighs the risk, because the benefit is there's a 95% effective rate with this Pfizer vaccine that can make it so that there's a very low probability that you'll contract COVID-19, which has a side effect for a lot of, unfortunately, to be death.
Dr. Quinn, how about your patients? Have they expressed any kind of concern about taking the vaccine to you?
They have. And interestingly, my wife and the rest of my staff all day today, we've been doing paperwork very, very rapidly, because the Mississippi State Department of Health is allowing clinics locally to register, such as my clinic. So we're doing the paperwork right now, and we're hoping that we can get our doses, because we feel that a lot of our patients might feel more safe to come to their family doctor or their local physicians and get the vaccination, and we will reassure them, but there is a lot of concern.
Yeah, there's a lot of concern about people wanting to wait until they see what the side effects are going to be. Yeah. How do you reassure them that this is going to be a safe vaccine?
Well, what I do for my patients is I educate them that they are using new technology, very advanced technology, where they're using messenger RNA. And this is part of the DNA sequence, so that when the vaccine is introduced, your body produces proteins that are the same as the spike protein of the actual coronavirus virus, but it's not the virus. So you can't get the virus infection from the vaccine, but you only produce the protein, and then your body's immune system produces the antibodies to fight it off. And that's a lot of the side effects, is your body revving up, getting ready to get that material so that you can beat the coronavirus. And this is how I reassure my patients, and I feel very confident that we will get a lot of people vaccinated, and we will get through this pandemic.
Well, actually, this is different from the flu shot then, because with the flu shot, you actually, of course, you know, here I am expressing my medical degree, but aren't we getting like the dead virus in the flu shot? So with this, we're not even getting the virus at all. Go ahead.
Basically, it's inactivated, and you do get more of the virus. But with this coronavirus vaccination, you only get the messenger RNA, messenger RNA material that produces the protein for that spike protein, and that's the part of the coronavirus that attaches to human cells and allows the coronavirus to enter the cells and infect them. But by producing these spike proteins in your body produces these antibodies, and then if you are introduced to the coronavirus, you can fight it off right away and just destabilize it, and you have less of a chance of passing coronavirus on to others. And this is how we could stop this pandemic. So this is a very exciting time. It's going to take a lot of education such as this, but we will get through this pandemic.
And Dr. Quinn, when the vaccine comes out, you and your staff will take it right away?
Most definitely. And as I said, right now, as we speak, we just sent the last batch of paperwork to the Mississippi State Department of Health. We're at the top of the line to receive the vaccinations for ourselves and our patients. And we're just very thankful that we have the opportunity to participate so that we can help to make Mississippi healthy again.
Dr. Timothy Quinn, thank you for dropping in on us this afternoon. Always reassuring. I feel better after talking to you about these things. So thank you very much.